Don't forget to say that. But in the test, it coming like you're in a nursing home, taking care of an elderly person. So you check the diet card to make sure you can write that down. So you remember. You have to have notes on every procedure, you know. When you make notes on feeding, you write that down. Say to the examiner, I will check the diet card to make sure that I have the right tray. Okay. And you come and you sit it. And you put the napkin to protect her clothes. You see it? Put in this napkin to protect your clothes. And you have to sit down. And they say, if you start the patient and don't give them a drink to moisten them out, you're going to fail this procedure. But it's a safety mistake. Because elderly people's mouth get dry. And if you put food in dry mouth, they will choke. You follow? So you're going to, here's some juice to moisten your mouth before you eat. Give her some juice to start with, alright? Then, it's a snack, you know. You can say, Mrs. Smith, you have some lovely chocolate pudding here. Do you like chocolate pudding, Mrs. Smith? Very good. And in the test, I will open this for real, because the nurses said, eat it for real. And you have to give them 3 pudding, 3 spoonfuls of the pudding and 4 drinks. And that's it. So, you open it for real. You take some out, say, open your mouth, Mrs. Smith. Take your time and eat slowly. Alright, that's the first one. And when you watch her eating it, they say, here is some drink to help you to swallow. So how many drinks you get, you know? 2. Remember you start with 1. How many drinks you going to give? 4. And 3 pudding. Is your mouth empty, Mrs. Smith?
Yes.
If you put food in a patient's mouth while food is it, what will happen?
Choke.
You're going to choke. So you're showing the examiner that you know how to feed these. And when you start to work, that's exactly what happens. That's why the people with stroke, all this is hard for them to swallow. Even pudding. You understand? For they have difficulty swallowing. So your mouth is empty, so let me give you some more pudding. Open your mouth. Take your time, eat slowly. Remember, this is his second pudding, right? And you watch her eat. Here is a drink to help you to swallow. So how many drinks you get there now? 3. Right. Your mouth is empty, Mrs. Smith?
Yes.
You are eating good today, Mrs. Smith.
Oh, yes.
The children are coming later to see you.
Yes,
carry on a pleasant conversation. All right? Now, I'm going to give you your last pudding. Take your time, just like you've been doing. You've been doing very well, Mrs. Smith. Eat slowly, but you don't want them to rush. Take their time, and here is a drink to help you to, and that's it. And you see, this way you know when to stop. After you give them 3 pudding and 4 drinks, you stop. And you wipe her mouth for real. And you say, you did very good with your meal today, Mrs. Smith. I'm going to ask you to please remain sitting up so that your food will digest. And you get up, and they say the examiner let you throw away the pudding and most of it. And the rest of the tray you put on the table in the test. And of course you would go back to her and you would, Mrs. Smith, please let me remove your table.
Okay.
Put your foot down gentle. Put back her table at her bed. And Mrs. Smith, this is the call signal. Please call me if you need me. No, if she don't hold it, you know, you're sure. You see, that's why you, in the test you're going to have her near. She's going to be sitting near where she can't reach it. You see, this is it, you sit her near where she can't reach it, because but patients do not sit and hold call signal. You put it where they can reach it. Are you alright, Mrs. Smith? Would you like to watch a TV or read a magazine?
Read a magazine.
Okay, I'll get a magazine for you. Thank you for your cooperation. And what else you think you're going to do to conclude this procedure?
Wash
My hands and chart it. If you don't chart it, you will fail.